Alright, hello everyone. So here we are with another question of discussion from our DQB DAMS question bank psychiatry segment. It's a clinical minute. Let's read the question first. It's a snapshot from our DAMS question bank. A 23-year-old medical student comes to the emergency room, young emergency room. Okay, elevated heart rate, short sweating, and shortness of breath. The student is convinced that she is having an asthma attack. 23-year-old young medico asthma attack. She will suffocate and die. The symptoms started suddenly during a car ride to the school. A student has had episodes such as this on at least 3 previous occasions over the past 2 weeks. So it is an episodic illness, sudden onset, feeling of impending doom, that I will suffocate, paroxysmal anxiety. Okay, now afraid to go leave the school, leave the house, and even to the school, plus escape phenomenon. Moreover, she has no history of asthma, and other than increased pulse rate, physical findings are unremarkable. So, organic cause less likely. When the patient presents to you with a sudden onset acute exacerbation of anxiety symptom with a feeling of impending doom, the diagnosis is panic attack. But since this girl is having frequent attacks over the past 2 weeks, we can call it as a panic disorder. So the diagnosis of this case is a panic disorder. A similar question to this came in a NEET PG 2020 also. Okay, now the question is, which of the following is the immediate treatment of this patient? Immediate treatment. We all know that panic disorder, the drug of choice is SSRI to prevent acute attack. And SSRI belong to antidepressant agent. But here SSRI is not the drug of choice because they have asked immediate treatment. Immediate treatment, drug of choice for panic attack to allay anxiety immediately is a benzodiazepine. That is the difference in the treatment when they ask a treatment for a panic attack or a panic disorder. We say for panic attack, since it is an acute anxiety condition, we will prefer to give benzodiazepine. But for panic disorder, since it is more or less a chronic type of condition with episodic exacerbation, we will give SSRI. This entire question is based upon this. Beta blocker are used to take care of only autonomic symptoms or physical symptoms of anxiety like palpitation, sweating, etc. Buspirone is not used in acute conditions much. Okay, so the answer of this question is a benzodiazepine. So this was a question taken from DAMS question bank DQB. We encourage students to practice questions from DQB. This has a high standard of good quality clinical questions, especially the clinical minute section. it has good enough amount of learning to you to make you understand the clinical concept, and we suggest students to practice these questions after attending the class so as to gain the concepts. We have started a series on YouTube, and there will be many such questions we'll be discussing, okay, in psychiatry and in other subjects as well. If you have any queries, you can get back to us. Thank you.